Hello, this is Shweta Saraswat from Bacha Panthi. Welcome to our live session. According to CDC, 1 in 36 children in the United States and 1 in 160 children globally, according to WHO, 1 in 160 children globally have autism spectrum disorder. So today we have a special session in which we will talk about raising awareness about special need kids' acceptance and promote their inclusion and respect in the community. Today, we're going to talk the most common questions parents usually ask us. So we have here Dr. Shyamla Deepthi from Ohio, USA, and Ms. Ananya Biswas, who is a special educator teacher of Bachapanthi, training our team in India. So how are you guys?
Doing good. Hope you are also doing good.
Good, awesome, thank you. So let's start with a brief intro. I would like to request Dr. Deepthi first.
Hello, everyone. I'm Dr. Shamla Deepthi. I'm currently working as an outpatient psychiatrist at Ohio Health Marion General Hospital. And I've been practicing for the past 5 years. I'm happy to be here, part of the session.
Awesome, welcome. Thank you. Ms. Ananya.
Okay, hello everybody. I'm Miss Ananya Biswas and I'm a special educator. I'm in this field of special education more than 22 years. And also I have worked in USA for 6 years and now working in India also. And I have some degrees also in the special education field. And I'm happy to be here as a part of Bacha Panthi. Thank you for giving us the opportunity to talk.
Welcome, both of you. Thank you for joining us. So I will start with Dr. Deepthi. Just define autism, like in a simple language. What is autism?
Sure. So autism spectrum disorder is a neurodevelopmental disorder, which is characterized by two main core deficits. One is a deficit in language or communication skills. The other one is called restrictive or repetitive behaviors. So people who have difficulty in social communication, they have a lot of difficulty in making conversations or even understanding a conversation. Whereas the repetitive or restrictive behaviors, the individual is overly dependent on routines or rituals, and they get intensely focused on specific items or activities. The other third criteria is this a pattern of behaviors are observed in the early developmental period of childhood, like around 1 to 3 years of age. And these deficits, they can cause social and occupational dysfunctioning as well. So an individual, if they meet the criteria for this, or these, they meet the criteria, that's called, they're diagnosed as having autism spectrum disorder.
Thank you. The most common question that we get from the parent that when did they notice these signs and symptoms first? So if you can mention about the signs and symptoms of these children with autism.
Sure. So autism can be, like I mentioned, it can be identified at a very early age, between like 1 to 3 years of age. And parents identify these children having difficulty with their language or speech or social skills, or having difficulties making eye contact, or social smile, etc. That is when they bring to the clinician for an individual evaluation. The most common signs of autism that we see are, number one is lack of eye contact or minimal eye contact. Number two is they don't smile, or they don't even respond upon calling their name. Number three is they can have lack of interest in making relationships with other peers. Number four is they can have speech delay, or they can have very minimal speech. Some of the symptoms of autism include like they can get very insistent and persistent on certain routines and rituals. They can have difficulty expressing their needs verbally. They can also have difficulty in if they prefer like staying alone, and they have problems with coordination or making odd movements and patterns. So these are some of the signs and symptoms of autism, but there's a like they can present in a different varieties, but these are the most common ones that we see.
That's helpful. This is for Miss Ananya. As a special educator, how do you identify these kids based on your teaching experience?
Okay, this is normally actually the same what Miss Dipti has said, like the same thing. When a student's coming to the school setting, first we see that he or she is not giving any eye contact, and the student is being in their own world. And also, if we are giving them in the social group, he is isolating himself. He is not mixing up with the other students. And side by side, we see some repetitive behaviors also, like hand clapping and hand flapping, then rocking behavior like moving their body rock like this, and there is some things always they used to do like this kind of things. There is something repetitive behavior that they used to do. So with by that all these signs we know that okay, this is going through autism child and we need to help them.
Okay. So, autism is not a disease, it's a deviation from a normal child. So, Dr. Deepti, how do you diagnose these children? If you can spotlight some important points of screening
Mhm.
um, so that it will be helpful for other parents who are facing these challenges.
Sure. First of all, we have to differentiate this autism spectrum disorder from other mental health conditions as well. And they can also have comorbid conditions, including language disorders. They can have learning disorders. They can have hearing impairment. It can be, they can have something called as ADHD, which is attention deficit hyperactivity disorder, and some can also experience anxiety disorders or separation anxiety disorders, etc. So you need to differentiate, the whole pattern from autism spectrum disorders. And like I said, ASD can have associated comorbid conditions as well. Apart from this, there should be a comprehensive evaluation that needs to be done. So the first of all is obtaining a history. It could be from the parents, the teachers, and the therapists who are there working with. They can give a broad, comprehensive history. And then the second thing is focusing on the signs and symptoms of autism by using different rating scales to diagnose autism. And third thing is focusing on the complete physical exam to rule out any other medical conditions. Number four is doing some genetic testing, whether there's a family history, there's always a genetic inheritance there. Number five is a few neuroimaging studies can exclude other medical conditions as well. So having a complete comprehensive workup, I think, is very essential as a part of the diagnostic part. Yes.
That's helpful. So when they come to school or like as a special educator, how do you handle these kids? And as Dr. Deepti mentioned, that social skills are the most common skills that they are missing. So how do you take care of them to improve these social skills, Ms. Ananya?
Okay, yeah. For the social skills improvement, first what we do, we make them in a small group. Any activity, first we have to identify his likings and dislikings, whatever the things he likes. Sometimes, we have seen that the students having the messy behavior, like they used to play with the messy thing. So that time we used to give them the slime or Play-Doh, things like that. So we used to make a small group of children, like two or three, where he can take part, and we give them the liking activity that he should enjoy. And then when he is taking a part and he is taking initiative, he is coming out from his own world and he is doing the work. That time what we used to do, we used to make a big group, and slowly we are also increasing the activities also, like from the play, what we want him to, maybe that we want him to write. So what we are using, we are giving them to play with the slimes or Play-Doh for 5 minutes. Then we are saying, okay, now we will write for 5 minutes. So we are giving them the 5 minutes writing with little bit of big group. So he is able to follow the instructions also. Our also he is being socialized in a big group. And also like this, we are academically, like with depending on his liking behavior, liking activities, we are increasing the activities and increasing the students number, but it should be like 5:6, like that, not more than that. We are when we are teaching, when we are taking classes and giving any education. But when we are doing any in social thing, when we are doing dance drama performance and any kind of your sports also, like as in now everywhere the inclusion setting is going on. Now I am also working in a school where there is a inclusive setting is there, and they are taking a part in the normal children also. So when he is habituated with the little big group, that time we are placing him for the play, for the dancing, for singing, for a little bit of if the student is bigger, then we are giving them the marketing also. They are going to the market, they are communicating with the people, purchasing things as a pre-vocational unit to make him independent, things like that. So in this way, in the school setting, we are working like this.
And how old
But
these
in, yeah,
how old these kids are that you are saying that they go to market and being independent? How old they?
yeah, the kids they are more than 13 or 14 years old when they are pre-vocational is starting.
Okay,
Yeah,
great. So this you talk about school setting. We have an
right.
online program of Pachapanti, that is mental poise, in which we have a dedicated team who are working with these kids, and a dedicated team that design their activities based on these kids' likings. Like their favorite toy or favorite cartoon character. So we bring games based on their likings. So, how do you manage these kids in online classes? If you can talk a little bit more about it, Miss Ananya.
Okay, in the brain online classes, we have the meditation program, and we have the brain gym exercises also, different kinds of, and we have brain stimulation activities also. And the students who are little bit mild and borderline autistic, they have, we are doing for them advanced mathematics also, and blindfold also we are using. And then recently one of our colleague is working with the non-dominant handwriting also with one child. So we are working all these on screen, like we have a set or 3 or 4 students in the on screen, and we are doing brain gym exercises, like when we are doing this finger rolling with the brain gym. This is enhancing our brain also, this is enhancing our brain power to calm down also, and to see attention. They will need to increase their attention span when they are seeing and doing this attention span, and then their concentration span will also grow, and they try to come into from their own world, and they try to communicate in the group also when we are taking the online courses also. And we have a very big dedicated person also. We have a team, dedicated team, who are working on, it's called mental pause, where we are working on this, and design the activities especially on their features, characters, liking, and favorite toys, etc.
Okay, thank you. Dr. Deepti, parents are always curious to know what age should they come to the clinic or approach the clinician, and how do you manage these individual clinically?
Sure. Like I mentioned, you know, children with autism, they present at a very early developmental period. However, some of them can, present at a later age, but still, they're identified at a very, very early age. Um, and some, I mean, as Ananya mentioned, the number one thing is the behavioral therapy, which is called as, I
So when
can't.
you say age, like can you specify like 6 months or one
Yeah,
year?
yeah, that's what early developmental period means. Around, from it be like 1 to 3 years of age. When you start seeing their developmental milestones, you start, you can observe them even as early as they're like 6 months old, when they start smiling, when they start cooing and crawling, and you can see how they're progressing with their milestones. And that's how early you can identify them. And some of them also can have they can show some development up till the age of like 1 or 2 years, and they can also show some regression in the development again after that age. So like it's a different kind of presentations for every individual. And mainly, like Ms. Anani mentioned, the behavioral therapy and social skills management play a very important role in the management of autism spectrum disorder. So we use something called as it's called as ABA therapy, which is like, it's a analytical behavioral therapy where we kind of you know train the children to learn some adaptive skills, to run their day-to-day life. That is what we kind of do the behavior therapy. And like Ms. Ananya mentioned, I think she pretty much detailed everything there. The other thing is speech and language therapy would be very helpful in people and children who have language deficits. And like she mentioned, like social skills training as well, where we kind of work with them to improve their social skills while they interact with others. And the fourth important thing is parent management training and giving some family therapy for the entire, family. I think educating them, bringing awareness is very important as well. And the other important thing is occupational therapy. I think that also plays an important role. So I feel like it's a common management is a combination of all of these therapies, but mainly focusing on the behavior therapy and social skills training. I think that plays a very important role in their later functioning, like in the society, or in their life.
Okay, how about medication? Do we prescribe them in medication?
Right. So I would say there is no particular medication as such for treating autism spectrum disorder, but it's a combination of all of these therapies. But we can still treat the underlying comorbid conditions. Say if they have an associated autism, ADHD, which is called as attention deficit hyperactivity disorder, we can treat them with stimulants. And if they have behavioral problems, we treat them with some mood stabilizers. And if they have some anxiety disorder, we treat them with some anti-anxiety medications as well. But otherwise, there is nothing like a cure, like complete, medical therapy for autism spectrum disorder as such.
Behavioral therapy and social skills plays a key role in this for the treatment. Awesome. Miss Ananya, another common question that parents usually ask us, and they are seeing significant improvement after doing these meditation and brain gym exercises. But as a teacher, I would like to know from you, what significant improvement have you seen um, um, doing these therapies and all those things that you do in your school and online setting? So, what significant improvement have you seen in these kids?
Yeah, I can say like that. As I told, like, one students with this autism, when they are coming to us, we have as Dr. Diti said, that we have a team, we have to work with that. They need special education, they need occupational therapy, they need physiotherapy, they need sensory integration therapy also. All these and ABA always there. We need to have that. So when we are doing these online courses, what is happening when we are doing in sensory therapy in the school system, we are using slimes, play-doh, these that, to make their sensory, like they have so many sensory problems, means difficulties which they cannot overcome, like hand flapping, like this they are going on hand flapping, or body rocking, they are going on body rocking, things like that, hand banging, like these things, but when we are doing in Bachapanti online on screen, what they are doing when we are doing the meditation, it is really helping them to calm down. This is also working as a sensory integration also, like, they are when we are giving them the meditation, and they are listening the om sound or any sound for the meditation, they are listening, they are closing their eyes, they are visualizing, and they are saying also om. So the whole senses, five senses are integrating and helping them to calm down and helping them to come out their take out their positive responses, which will make them a effective learner, you know also, like brain gym exercises, as I told you before also, we have several brain gym exercises, and the each and every brain gym exercises have a different role in their different activities. Every activities is helping autism kids to calm down, to decrease their restlessness, to decrease their and increase their attention span and concentration span. Always it's there. And then when it is developing, their attention increasing, their attention concentration span increasing, but their hyperactiveness is decreasing. That time we can do any kind of brain stimulation activities also, that is also helping them. And these all these things are reflecting their progress in their school setting. One of my kids in Bachapanti, I was working in autism, and I have gone through this phase, and I have given him meditation and brain gym exercises and brain stimulation activities, and we have worked with the, some kind of mathematics also. We did some kind of blindfold also, and some of, like, 2 to 3 months after, his mom was telling me that some of the teacher called him and say that, wow, what he is doing, that there is an enormous change in his behavior, we can see. Before, he not used to go to the students, not mixing up anybody, he is isolating himself from the others, but now he is taking initiative, he is taking part of everything, he is doing his work, he is coming out of his loneliness, and he is giving us responses to the questions we are asking. So that is a big success in my seeing online courses for Bachpanti.
So, this we all talk about what we can do as a teacher, what the clinician can do, and how they can help. But if you would like, we would like to know, like, how parents should embrace these kiddos' unique strength and neurodiversity. Like, what do they do to take care at home to while dealing with these types of behaviors? So, any suggestion for the parents that they can do at home with these kids? Miss Ananya. Oh, the issue with the network. Miss Ananya, are you
Yeah,
there?
sorry. Yeah, I'm there. Yeah.
Well, did you hear my question, or I can repeat? What tips you?
No, I hear. Yeah.
Okay, that's good. So, what tips? We are disconnecting Miss Ananya. How is your Sunday going, Dr. Deepti?
Going good so far. Just busy
Oh,
with.
she is not here. I'm so sorry, there's some internet issue with Miss Ananya. So let's move ahead. So I'm going to wrap this session. Thank you so much for your valuable insights and a wonderful session. Let's see if Miss Ananya is here. I was just wrapping it up with her last message to the audience. So let me call her if she's here. One second, I think she's joining us back.
Yeah,
Hi,
I'm having some
I'm
network
so
issues.
sorry.
It's raining. Yeah, it's raining outside. So
I know it's raining heavily in
yeah,
India, huh? Okay.
yeah, it's raining. Yeah.
Thank you so much for your valuable insight and a wonderful session. I will wrap this session with your last message to the audience. So, Ms. Ananya, what would you like to say as your last message to our families who is watching this session?
Okay, my message is giving training and exposure. Both is very important thing. You need to give training, like as we have said, that so many trainings we have already said, mentioned. You have to go on, keep on do like this. You can't stop anyone. And exposure. Don't keep them alone in the home. You have to take them out of the home. You have to socialize them. You have to take them to the party. Don't be shaky and keeping them, okay, I got an autistic child, okay, what I will do, I will not take him out, I will keep him inside. No, not that. Give him exposure, give a normal life to them as much as possible.
Sounds good. Thank you so much. Dr. Deepti, your last message to the families.
I would say focusing on early identification and intervention plays a very key role in especially improving their social and language skills and thereby improving their quality of life and better functional outcome.
Awesome. Thank you so much. Heartfelt thank you from all our team members to both of you. Thank you for joining Lovely Morning with us. As Dr. Deepthi and Miss Ananya has mentioned, so just focus on your kiddos, learn their signs and symptoms, act early. If you act early, it will have a beautiful impact on their lives. So thank you so much for joining our session. You have a wonderful rest of the weekend, Dr. Deepthi and Miss Ananya. Have a wonderful night. Thank you so
Thank
much.
you.
Thank
Thank
you.
you once
Thank
again for
you.
the opportunity, and you all have a good day.
Thank you.
Yeah, same. Thank you. Have a good day.
Bye.